Okay, good afternoon, everyone. I got two clocks in front of me. One of them says 2:15, one says 2:14. So we're going to split the difference. Welcome, everyone, to our afternoon virtual press conference. Thank you for joining us, members of the media. Thank you, panelists. And I could be corrected here, but on our panel, either to give a statement or there to answer questions, we have Mayor Brown in the city of Grand Forks. We have Deb Swanson, Director of Grand Forks Public Health. We have Dr. Terry Brenner, Mayor Brown, Dr. Deer, and as I'm looking at this, Dr. Brenner, give me a thumbs up or not if you just want to answer questions or if you have something to say. Do you have something to say, Dr. Brenner, as part of a statement? You do? All right. Mr. Gockler, yourself, do you have a statement or just to answer questions? A statement, thumbs up. All right, we'll go through those as far as statements and then answer questions. We hope to wrap this up by 3 o'clock as there is a separate business listening session via Zoom at 3 o'clock. So, Mr. Mayor Brown. Go ahead, Mayor.
Thank you. Well, good afternoon, and thank you all for joining and staying informed. As of this time, there are 5 confirmed COVID cases in Grand Forks County. The virus is here and reinforces the need for us to be vigilant and cautious in the weeks ahead. This will be a marathon that we need to be prepared for at least another 6 weeks of this way of life. I'm proud of all the work done by the healthcare professionals in our community. They're working around the clock to keep us safe and healthy, and we must do our part and stay home. The virus does not spread itself. We spread it. If we stay home, we avoid getting it and spreading it to others. We've heard of incidents of people in our community not following the guidelines of physical distancing. Grand Forks residents should not be putting their neighbors at risk. This is unacceptable and not representative of who we are. We're a good community that looks out for one another. Stay home, wash your hands, practice good hygiene, and sanitize frequently used surfaces. All citizens taking these measures is the only way Grand Forks will emerge from this pandemic strong and healthy. It's important to continue to be strong and healthy during this new norm of physical distancing. Physical distancing does not mean social isolation. It's imperative in all ages. Here's another update. Our city staff is executing the flood action plan. The flood outlook has gone up in the past couple of days, but still within our flood protection project. The crews that do bridge closures will be needed for snow removal later this week due to the upcoming storm, and we expect the water to rise a bit as a result of that. We're being proactive, and our public works crews started closing the Sorley Bridge on Demers Avenue at 1:30 this afternoon in advance of the storm. Please go to grandforksgov.com/flood for information and updates. We've heard a lot of feedback from the community about paying rent and the potential for possible evictions during this time. I do not intend to engage in a regulatory manner at this time regarding private property issues to include rent, eviction, and other contractual matters. I encourage the private sector to continue to be flexible, adaptable, and compassionate in this extraordinary time. Oh, and today is Census Day. If you haven't done it already, make sure you fill out your census. It's even more simple than ever and can be done right on your cell phone. It took me only 5 minutes. Respond to the census today by visiting 2020census.gov. This is the perfect opportunity to check in with your friends and family and make sure they filled one out too. Maybe even make it a contest who can fill out the quickest. We need to count all our people because all of our people count. We're in this together. We'll get through this together, and together we'll emerge stronger than ever. Thank you.
Thank you, Mayor. Next, we'll head over to Dr. Deer from All True Health System.
Thank you. Good afternoon. As of today, we've seen an increase in our cases in Grand Forks County, as you just heard, up to 5 total. All True's COVID line continues to be operational with hundreds of calls per day. Our sick clinic remains active, and our other locations are screening all patients and visitors, doing our best to keep clinic environments safe. During this pandemic, we've needed to think how to care differently, particularly with the delivery of care. Due to the ability of our technology team and the creativity of providers, we're now able to offer many ways to connect with our All True Care providers. The primary route of this is through MyChart, and encourage our patients to sign up on alltrue.org. Testing continues to be brisk. We're now up to 840 total tests performed at All True locations as of this morning. 742 are in the Grand Forks, East Grand Forks locations. As of this AM, we continue to have ample supplies and we have 477 available tests for community use. This pandemic and planning associated with it has allowed Altru to work side by side with our community partners. This includes group homes, nursing homes, senior living centers, the city, county, and state government, and other health systems throughout our care networks and beyond. It's an unprecedented time for collaboration, and we'd like to thank all involved for this. Our focus continues to be what is best for our patients, the community, and our staff. Thank you again.
Thank you, Dr. Deer. We'll head next to first day of school, if you could say, to Dr. Terry Brenner. Dr. Brenner.
Thank you, John. You stole my thunder. Today is the first day of school for our pre-K through 12 students using an online distance learning platform. And again, just to remind the public, the heroic effort that teachers and principals pulled off over the last 7 business days is just remarkable. It's extraordinary, as a matter of fact. This is something that we would have planned for over the course of 2 to 5 years. We planned for this over the course of 2 weeks and have implemented successfully today. We have 7,500 devices out to each of our students. And for those people who didn't have connectivity, internet connectivity at home, we've provided that for them. If somebody out there is still missing some internet connection, we would ask that they contact the district office, because there might be a couple of people who didn't get the survey number 1 or survey number 2. What I will say is this is a new era of education. This is the new normal for the time being. This won't be the new normal forever. We want our students back at the campus level, and students want to be back at the campus level as well. We also know that this has put an extraordinary responsibility and effort on behalf of parents, working parents and parents who aren't working. They've had to create new schedules at home for the teaching and learning process, whether that is for synchronous or asynchronous type learning. We've managed the hiccups today, had a meeting with all of our principals here at 1 o'clock and asked them for some feedback, both positive and what the hiccups might be. And they said, by and large, the feedback they've had from parents is quite remarkably positive. A few of the issues that we've had, maybe families who have 3 or more children where they're all online at the same time, bandwidth is a problem in their household. And we're going to try to figure out ways to mitigate that for those specific families. So again, this is day 1 of, we don't know how many days we'll be in session like this. We will follow the lead of the governor, but we are watching how COVID-19 is really moving towards the middle of the country. If you look at a map of the United States and you see all the executive orders from governors, it's pretty much everything east of North Dakota and west of North Dakota. And when you look at North Dakota and straight down south, maybe to Texas, those are the states who haven't issued that order yet. So we'll be anxiously awaiting to see what Governor Burgum does and to see if that is going to prolong the situation that we're in. All spring activities, which involves co-curricular and extracurricular activities, are on pause. We are following the lead of not only the governor, but the North Dakota High School Activities Association. And so, as I said here before, my heart bleeds for our seniors who were not able to finish a state basketball tournament, or they have not been able to start their spring sport season. With that, just a couple of other highlights. Emily Carl, who is our Director of Child Nutrition, she just on Monday and Tuesday of this week, lunches served, 1,640 approximately each day. Breakfast served, 1,831 today, and another 1,855 for tomorrow morning. So our families are taking advantage of this tremendous opportunity where we keep our kids fed, and we're really pleased about that. And I just have one plea for the community, those people who are listening, and maybe you can share this with your friends as well. While our school campuses are closed, our playgrounds are closed as well due to COVID-19. Most of our campuses, we don't have fences up to secure playground equipment, so we would just ask the public to remain off of the playground equipment. There will be signage up shortly, but it will really be incumbent upon patrons to follow our lead and stay off the playground equipment, as tempting as it is when you get kids outside. So that is the update from the school district, and I will yield the rest of my time to perhaps my colleague, Mr. Gockler, if that's the direction you're going, John.
And you stole my thunder. Yes, Mr. Gockler, we'll have you up next. Mr. Gockler.
Okay, thank you, everyone. So my association here on the panel, I'm the mental health coordinator for the public schools. And the public schools is one of approximately 40 organizations or providers here in Grand Forks that comprise our group now known as Mental Health Matters, which is a Grand Forks community collaborative, obviously around the topic of mental health. So I was asked to come on today and talk about the challenges that our community is dealing with and how to maintain positive mental health during the COVID-19 outbreak. I think probably the best place for me to start is just acknowledging the stress that many people in our community are experiencing. Stress, as we all know, is often brought about by change, by uncertainties, and then specific stressful situations. And safe to say that Grand Forks is one of communities all across the country that are experiencing that, whether that means for some people less work, other people, maybe the work demands have increased tenfold. Some it's financial stress, some it's academic stress, learning from home in a new environment, possibly health concerns. As Dr. Brenner just alluded to, the grieving doesn't always come from the loss of a loved one. Sometimes it comes from the loss of an event, or whether it's a sporting event or a fine arts event, or something that people have trained for some time. And I think instead of dwelling on the stress and the stressors, I think it's important to acknowledge them, but at the same time to pivot a little bit and talk about how do we address mental health in face of these challenges and cope with these challenges. So I've shared a resource, and it's on our Grand Forks Schools website under our mental health hub that I put together for today's panel. It's just a simple 6-step process. I don't want to oversimplify things. Mayor Brown, you alluded to some of these very things in your opening address. I'll start with just finding reliable information. That's step one. And the city has done a great job on the Grand Forks Gov site with links to public health and then resources for the community, whether it be food resources, utility resources, business resources. That's all important for people to have reliable information right now. I mentioned the Mental Health Hub. Like I said, it's at gfschools.org, Mental Health Hub. I've assembled probably a dozen different resources there specific to COVID-19. Everything from how to nurture your well-being when you're working in isolation at home, to staying resilient during times like this, how to talk to kids that maybe have their concerns, and then just how to care for your mental health in the face of uncertainty. Number 2 is staying connected. And this is what Mayor Brown talked about, whether it's picking up the phone or having a chat like this online with family and friends. I've challenged my family. We're writing one handwritten card each day. It's a simple thing, but it helps us stay connected. And as a society, I think we oftentimes crave that connection, and it's put that in focus now that we, maybe sometimes take for granted the connections we have throughout the course of a day, and working from home and isolating, keeping our physical distance just highlights the importance of that, I think. Number 3, one thing we haven't talked a lot about yet today is the importance of maintaining and establishing routines. And what that can do in face of that uncertainty, it helps provide maybe a little bit sense of control or calm. So whether that's keeping your sleep routines, your exercise routines, and learning how to balance working and learning and relaxing when everybody's all under the same roof. As far as activities, another way to find balance, trying to find ways to get healthy activities, whether it's an extra walk of the dog or hopping on the treadmill. I was walking through the kitchen the other day, and my middle school daughter was online, taking advantage of some of the free Peloton classes. Apparently you don't have to have one of those expensive bikes, and asked me to sit down and meditate with her for 5 minutes. So took advantage of that. So, but balancing those physical activities with calming activities, and that's not one size fits all, but I guess I would encourage any listeners to find activities that keep you calm, and engage in those activities. And then sharing resources. There's a lot of people in our community that are in financial need, spiritual need, physical need, emotional need, and those of us that are in a capacity to provide some help. Generosity can really help provide help people overcome some of the difficulties that we're experiencing in our community. And then lastly, final step 6, the importance of seeking professional help if you need it. We've developed a website, www.gfcares.com, and I would encourage everyone in the community to take a peek. It's under development. The part that we have developed first and foremost that I think is important for the community to know is a list of local mental health service providers. And we've been on the phone the last couple of days here and contacted as many providers as we can to see which ones are offering telehealth services. So we've added a column to that listing online. Like I said, gfcares.com. We also have helplines and crisis text lines. So whether that's the suicide prevention lifeline or our local North Dakota 211 service that provides listening and support and connection to resources. And again, I would also encourage people to explore the resources available to them through their employee assistance programs. Lots of resources out there, and I just hope that people take advantage of that and find ways to support one another.
Thank you, Mr. Gockler. We'll open it up to the media, and as they get organized there, I do have one question that came up online. This is for Dr. Brenner. Could you go through, please, the schedule and well, not so much in too much great detail, but talking about the school lunch program? Is that program still going on for pickup at local schools? And what's the schedule for that?
Yeah, thank you. The schedule, I believe, is 11 to 1. And it's at all of our elementary school campuses. That's where parents can pick up. And when we started the program out, children were required to be with parents to pick up the meals, but that has now been waived by the governor. So 11 to 1 at all of our elementary schools, Monday through Friday.
Thank you, Dr. Brenner. First question from the media, Mr. Joe Bowen.
Yeah, hi. This is one from on Monday that I think Josh is going to come back with an answer. Will Ultra be sending people to collections for past due bills during the pandemic?
Yeah, in the current crisis, if it's changed the patient's ability to pay for your current balance at Altru, please contact our patient account representative at 701-780-4050 to review your account.
Thank you, Dr. Deere. Hand up from KNOX.
For Mayor Brown, could you elaborate on the 6-week time frame? You mentioned in your opening statement today that we have to get ready for life like this for another 6 weeks. The direction from the president's administration has been through April 30th. Tell us why the time frame takes you through May 15th.
Because it started later in Grand Forks. As you see, we just had 5 cases and the rest of the country is ahead of us. So they may be recovering long before we do. And I think 6 weeks is a reasonable time span to expect this change, if not longer.
So if I can follow up on that, is it your intention then to keep, for example, the restaurant closure through May 15th?
We will follow the governor's guidance and see what CDC and the public health says. But that is our impression right now, is to keep people safe and remind them to stay home.
Question now from Mr. Joe Bowen.
All right, so I wanted to clarify what Josh was saying there then. So this is kind of a yes or no question. Will Ultra be sending people to collections for past due bills during the pandemic?
Yeah, I've shared what I can share on this topic. Thanks, Joel.
So to clarify, your answer to will you guys be sending people to collections is here's the number for someone you can call if you're not sure you can pay.
Yeah, correct.
Okay, KNOX, your hand is in the air.
Yeah, a question for Dr. Deere regarding the testing. Can you tell us at all, Dr. Deere, about what the accuracy of the COVID-19 test is? We had a question. Someone just kind of wanted to know if there's any concern at all about like false negative tests. Do you have any data that you can share about how accurate the test has been found to be since it's been in practice?
Yeah, I can share some rough numbers. As you know, these are all changing as we get more and more tests and there's more data showing how sensitive and specific it is. It's a very specific test, meaning that if you get a positive result, you have the disease. It's the sensitivity of the test has been argued about, but roughly about 80% of people that have the disease will test positive.
Thank you, Dr. Deere. Looking at the media, looking for any hands in the air. Mr. Joe Bowen.
This is one we got from this is one we got from Facebook. Is there or is there not anywhere to get free testing or hospitalization during the crisis?
I'm going to look to Dr. Deere on this one.
Yeah, the testing that we're doing for the coronavirus specifically is free. But as far as other cares that go along with testing, at this time, we're practicing as usual.
Thank you, Dr. Deere. KNOX.
Question for Dr. Brenner regarding the distance learning. So there have been some reports, there were some in North Dakota today, obviously Minnesota yesterday, regarding the Schoolology platform being overwhelmed and kicking people out of its server. I don't even know if the Grand Forks district is using the Schoolology platform. So if you're not, you can just say it doesn't affect us. If you are using Schoolology, have you had any of those similar problems?
To my knowledge, we're not using it. We're not using Schoolology as a district. We're using Seesaw, basically K through 5, and then we're using Google Classroom 6 through 12. That doesn't mean there isn't a teacher who's using the platform that you mentioned, but that is not a district-directed platform.
Thank you, Dr. Brenner. Taking a look at our media, looking for a hand raised, Mr. Joe Bowen.
Yeah, this is another one from Facebook. Are there any plans for getting more testing in Grand Forks, and how's the testing supply look?
Dr. Deere.
Yeah, at our current testing rate, we have enough supplies for greater than 10 days. That said, the testing will change if and when we have community spread. Then your testing kind of expands and your amount of tests will probably go up. As you've seen in Fargo and Bismarck, as they've had community spread, their amount of total tests done has increased. And we've been testing appropriately according to North Dakota Department of Health guidelines, and we'll continue to follow their guidance if we ever do more restricted testing in Grand Forks County based on supplies.
All right, with that, we will break away from our
Okay.
coverage of the event here today.
Ryan, if you can mute yourself, that'd be great. Thank you. Mr. Joe Bowen.
Hey again. So let's see here. It seems like the governor is, at least for the moment, not going to put a moratorium on evictions, foreclosures, late fees for renters, anything like that. At least hasn't yet. Is there anything that Grand Forks as a city can do in his stead? And if so, is the mayor willing to do it?
Right now, I trust the free market, and I think that it's a business contractual thing between you and your landlord, and I think the landlord's going to be compassionate. And if you have difficulty paying, plus we have stimulus checks coming, plus we have unemployment coming, and I think people will work out ways to pay their bills and work things out. So no, we're letting the free market continue.
Thank you, Mayor. Mr. Bowen.
All right, so this is another Facebook question. If there's not going to be any protections for renters, is there a plan for newly homeless?
As I look at the panel here, I'm not sure if we have anyone on the panel that could really address that one, Joe. I'm looking if anyone wants to raise their hand to take a shot at it. It is one of those, Mr. Phelan.
John and Joe, I think in that regard, as the mayor has spoken, we're going to the best of our ability, rely upon the private and public sector for housing of individuals in our community. And some of that might be rental units, whether they're in the public or private sector. It may include our Northlands homeless shelter and other opportunities for people to be sheltered in various degrees. Those that are falling through the cracks, we will do our best to find a way forward for them. as we always have. And in this particular crisis that we're in currently, we know it's an acute issue, and we will do our best as we move forward and identify where our gaps are. Thank you, John.
Thank you, Todd. I appreciate that. Taking a looking for a hand raised, Mr. Bowen.
Yeah, hey, sorry, I'm trying to take a beat just in case anybody else wants to jump in. So there's another community question. Why are daycares open if schools are closed?
Well, we're following the governor's guidance on this, and it appears that, and I'll defer to Deb in a minute, but it appears that children are not a vulnerable community. So I think we follow the governor's lead, and I'll turn this over to Deb.
Thank you, Mayor. Mrs. Swanson?
Yeah, I would say that the reason daycares are still open is because they're providing a really critical service that allows those essential workers to be at work. Those would include things like policemen, firemen, essential EMS services, all of our healthcare workers. They absolutely need, because oftentimes you'll have a family unit where both people are employed in an essential service. And so having a place for their children to go during the day where they're safe is really important. We also have provided a lot of guidance to child cares so that they're aware of looking for signs and symptoms of illness. They would be notified if anyone in the family tests positive so that that child could be excluded from that environment. So it's really essential that child care be maintained for this period of time. That's not to say that it couldn't change if we do see a lot of spread among children, but we're not observing that yet.
Thank you, Deb, for the answer there. Joe?
Yeah, sorry. So at what point might daycares be closed? And would that come from the city, the state, neither, both? What might that look like?
Ms. Swanson?
That will be a decision by the state, and it would be in consultation with the state health officer. And it would be largely based on new information about the disease spread in our state.
Thank you.
Like what kind of new information?
Number of cases, ages of people being tested who are positive, presence of community spread in certain age groups, that type of information.
Thank you, Deb. Joe, go ahead.
All right, sorry, I feel like I need to count to 1,005 just to make sure I'm not steamrolling anybody here. So this is another one from Facebook. Why are places like Menards and Lowe's still open, and liquor stores? Is there any plan to maybe limit traffic in and out, anything like that?
Well, right now they're still providing essential services for food and other things that we need in our daily lives. So as long as they're providing that service, and I do recommend people, if you do go there, you practice social distancing, you clean your hands, and get your business done as quickly as possible. But right now, they're still remaining open.
And fair to say, Mayor, the current closures are state orders and not local orders.
Correct.
Joe, the floor is yours.
All right, yeah. This is another Facebook one. Should it be mandatory that people with weakened immune systems or other health conditions be ordered to stay home?
Well, again, it goes back to using your judgment. And if you feel that you are at risk, then you would need to stay home, which we're advising everyone to do, not just those that are most vulnerable. So if you do have to leave home, when you do get home, wash your hands for 20 seconds and sterilize your surfaces that are frequently used. But we're encouraging everyone to stay home, and especially if you are at risk. So Deb, do you have any further things to add?
I just wanted to add that, of course, we know people with chronic conditions or weakened immune systems are more at risk of getting the disease. But typically when we provide guidance that's mandatory or requesting a particular behavior, it's because we're concerned about people spreading the disease, not necessarily currently being affected by it. So we want people who have traveled, who've been exposed, we want those people to stay home. Individuals who have a chronic health condition, it's our guidance that they stay home to protect their own health.
Thank you, Deb. Joe, any follow-up? Go ahead, Joe.
Yeah, so this is kind of a multi-parter here. So long story short, a woman on Facebook said she saw some teenagers wandering around yesterday, coughing on stuff, joking about how they just got back from China, ha ha And then other people I've seen or talked to are worried about like house parties at UND or groups of kids wandering the streets, that sort of thing. And I'm guessing the answer is yes, but is that indeed a problem health-wise? And if so, does anybody here have an idea of how to, get it through kids' heads or whatever to kind of stay out of public places and maybe congregate less?
Well, I think we'll continue our education with these populations, and the community is policing itself. We're getting many reports of people who have returned, their neighbors feel they're not self-isolating. So then we have to contact those people and say, this is the information we suggest you self-isolate for 14 days to reduce the risk of spread in the community. So Deb?
This is a concern, and I think it requires that we go back to the basic science of the disease. This coronavirus that causes COVID does not have a vaccine, and it does not have treatment. We simply treat the symptoms. So serious disease can result from this. We know that when people gather in groups, they're more likely to spread the disease. So we absolutely have to double down on our education, and more than ever, we need people to heed our public health advice. That's needed to keep all residents safe and healthy. So we're always looking at ways that we can change our messaging to reach certain groups. We're always looking for ways to reach teenagers through their parents, but maybe it's through their peers. Maybe they're not concerned about the disease, but maybe they have grandparents that they should be thinking about protecting. So if you have ideas, I would say this to the public about how we can make sure we promote that message to certain groups. We're absolutely interested in your ideas. It's going to take everyone to protect us from what has been happening in other parts of the country to not happen here in our community. And we're always looking for ways to do that with new messaging, new information. Now that students are back in school, we think that there will be less of this type of activity, but we are always looking for ways to ensure that we protect the public and the public's health.
Thank you, Deb. Go ahead, Joe.
Yeah, hey there. So this kind of a follow-up to that is, and this seems like this is kind of treading on a fault line that I think I've detected in a lot of these, and that is, if it is indeed a problem for public health, a concern like Deb was saying, is there anything that the mayor or the city or whatever is willing to do, or is there anything they can do to actually put a stop to it, rather than just suggesting it, but actually like putting some oomph behind it? Maybe a fine, something like that. You get like the equivalent of a traffic ticket if you're out and about for no good reason.
Yeah, we're early in this right now, so we're using our community officers to remind people, hey, this is not good health practice, so please disband. And if it gets to the point where we have to be punitive, then that's the action we'll have to take. But right now we feel that we're going the education route and hoping we get compliance, because we need to be aware that we're taking care of our neighbors as well as ourselves by staying home.
And Mrs. Swanson, if you wouldn't mind, on the second line of that, this reminded me, could you maybe talk a little bit from a health officer could put a directive on an individual if there were some issues like that? Could you talk a little bit about potentially quarantining an individual that may have an issue? I know this has happened in the past.
I believe that that's a slightly different intervention than what Mr. Bowen is suggesting, which is groups of asymptomatic individuals that might be gathering together. But when we do have individuals who have tested positive and they do not want to abide by the isolation, which is required when people have tested positive, then yes, there are ways that our health officer can order them to stay home. We certainly hope to not get to that point. We find that people are willing to comply once they understand how it impacts others, and education generally works. But yes, indeed, there is an opportunity for a health officer's order to isolate an individual to their home so that they don't spread disease to the population at large.
Thank you, Mrs. Swanson. Go ahead, Joe.
Okay, yeah, sorry. So I clicked my hand up when Mike was speaking, but I mean, could be a him or Deb sort of question. But at what point might things get punitive? At what point might, I get a ticket for just being out and about? Because I know it's third hand, but the lady who said she saw some kids wandering around joking about, oh, I just got back from China. Them doing that doesn't seem like it's a function of ignorance. They clearly know what the coronavirus is. They're coughing. They're joking about coming back from China. It seems like it's more a function of them not caring, because they're teenagers. Of course, they're not going to care. So at what point do you go from being like, hey, this isn't a good idea, to like, hey, here's a ticket?
I
Like
think
when
when
might we
we-
reach that point? What would that look like?
Well, I think when we start seeing community spread, then we'll have to ramp up our enforcement of these things. So now I'll turn it over to Deb.
Okay.
I don't have much to add to that. I don't know that we're at that point, but I think this is an opportunity for us to all care about one another in the community and an opportunity to educate. I agree that while you may feel that some teenagers don't care, I do think that if they're approached by adults in a caring manner and it's explained to them why it's important for them to be separated by 6 feet and not be in large groups, that they will be willing to hear that message.
Thank you, Deb. And Mr. Phelan, I saw you had your hand up.
John, I think just to add, if it's a case where individuals are hassling people or doing things that are inappropriate, that's certainly an opportunity for even law enforcement to provide some guidance and in situations like that, because you certainly are at least psychologically providing harm to individuals out in the public. So I think, as the mayor said, education is going to be the first thing, providing guidance along with that. But if we do need to enforce activities that are inappropriate, we will certainly move forward in that direction too. And so that there's no foolishness going on in our community. But as the mayor says, we'll use education guidance first, but certainly we are willing to use enforcement if needed.
Thank you, Mr. Phelan. Joe?
All right, cool. I only got a couple more here, so hopefully we can squeeze them in. So someone on Facebook was wondering if there's any more information anybody can say about some of those new cases in the Grand Forks area without violating, say, HIPAA laws. Is there maybe, they're wondering if there's a way to maybe speak abstractly that would still give some sort of useful information other than gender and age range.
The information is released by the North Dakota Department of Health because they are the ones that do the testing. So the information that's provided is all that's available. Once a case is identified, though, they do share that information with their regional epidemiologists who begin doing contact investigation. And then that leads to finding other people who might need to be tested. If you haven't been contacted, likely you haven't been in close contact with someone who's tested positive.
Thank you, Deb. Joe, you said you had one more?
Yeah, we're getting near the end of the list here. Some of these are more statewide, so no big deal if nobody knows, but want to do right by people and at least ask. Someone wants to know if the order banning foot traffic in like bars and restaurants and that sort of thing, if anybody here knows if that'll be extended or has it already been extended because it's supposed to expire relatively soon, is my impression, or at least their impression.
Looking to the group here, I'm not sure if we've heard any more direction from the governor's office, but it was a governor's order. And has anyone heard anything else from the governor's office? I don't believe there's been any other direction, as I see Mayor Brown shaking his head. So to your point, Joe, a state question, we're following the state's lead on that.
All right, one more state question, and then that's the second to last here. I think it's state level anyway. It sounds like one part of that federal stimulus bill would hike some unemployment benefits and also make gig workers and self-employed people more eligible. But it looks like it's not showing up in the unemployment portal yet. And this person is wondering if and when it will. Does anybody know? Got an ETA, a deadline, anything like that?
Unfortunately, out of our hands a little bit.
Sure.
We don't have control over that, which from the standpoint of we'd love to give some input, but unfortunately we just don't know.
Understandable. And then very last one, shifting gears a little bit here, is what's going on with river levels and flooding generally in the area. I know you guys closed the Sorley Bridge about 90 minutes ago. Anything beyond that people should know?
Mr. Phelan, Mr. Brown? Todd, go ahead. Oh, hold on, Todd. There you go.
Again, it appears we have moved forward with some early closures, mainly along the Greenway, Elmwood, Riverside Drive. Our pump stations, we have 12 flood stations. Those are ready to go with the gates when needed. And that generally occurs in the high 30-foot level to around 40 feet. So I think many of our pump stations will be activated by this weekend and early next week. And then also the closures. And so we've concentrated a lot in the Greenway, but with the winter storm that's coming through Grand Forks, the similar crew that's working on street closures and Greenway closures also do snow removal. So we're going to get the demers out of the way, knowing that would need to be closed anyway, late this week, early next. So we have moved that up. So I think what we heard today from the National Weather Service and our city engineer, Al Grasser, provided to us is that we're going to get a rise around 46 feet early this following week, and that will likely close the Sarley Bridge downtown and also the Point Bridge. Kennedy Bridge should be good to go with the predictions that we have. That's good until 52 to 53 feet. And then with the student moisture, they're anticipating about an inch worth of new precipitation up and down the valley. And so I think that what they've thought of is that there'll be a second crest probably a week later after this first one. And they're estimating at this point that could be in and around 48 feet. So again, the kind of shorter term, we're going to be in this flood response mode for the next 2 to 3 weeks also, in concert with the kind of the COVID reactions that we're working with currently too.
And they predict 46 feet in about 48 hours. So it's very important that we protect our downtown businesses.
Thank you, Mayor Brown. Thank you to the panel. Thank you to the media for joining. Thank you to those watching on Channel 2 and watching on City of Grand Forks Facebook page. Going through the list, again, Mayor Brown, Todd Phelan, Deb Swanson, Dr. Josh Deere with Altru, Jeff Gockler with the Grand Forks Public Schools Mental Health, and Dr. Terry Brenner, Superintendent of Schools. Thank you very much for joining us for this virtual news conference, and we will do this again on Friday. Have a good afternoon, everyone.